Okay, so still introduction to nursing informatics now. As I was about to say, when I say nursing informatics, you do not just talk about expertise in using the computer. Nursing informatics is actually about using technology in the care of your patient. That's why, guys, no, there's actually a field referred to as informatics. But if you can notice, what you are learning is what we refer to as your nursing informatics. So bakit nursing informatics? Because we would want to connect your patient care to the technology that are available to us. Okay, that's the main goal actually of your nursing informatics. And then please do not think that you are only learning nursing informatics on the second year or maybe on the third year of your course. Okay, it's very wrong for us to think na nursing informatics, tapos ko na yan nung second year, hayaan mo na yan. Actually, class, when we talk about the application of technology in patient care, that should continue when you will become third year students, when you will become fourth year students, and later on when you will become professionals. Because by the time that you will be going into the hospital setting, and then by the time plus that you are already taking care of your patients, you will be able to see how technology is being applied in the care of your patients. So as I would like to repeatedly emphasize, the focus of our subject is actually still the care of your patients. Okay? Hindi natin focus, class, that you will become experts in the use of the technology. Hindi natin focus that you will become experts in the use of equipment, software, and devices. But our focus is how to apply these devices, how to apply these technology in the care of your patients. Okay, so tandaan nyo, that's the focus of your nursing informatics. Now, can you recall that major subject that you have taken in your first year? What's the first nursing subject that you have taken way back in your first year? What's that nursing subject? Sige nga. What's that nursing subject that you have taken in your first year? Okay, first year, first semester. Yung iba parang staring blankly sa screen. Okay. Okay, what is that subject? Anatomy and physiology. Okay, so you have your TFN. No? You have your TFN. So you have your theoretical foundations of nursing. Now, if you would look at that subject, that very subject actually reminds us that theory is the foundation of nursing practice. Okay? Yes, health assessment fundamentals is already in the second semester now. So class, if you would look at the triangle no, that would relate theory, practice, and research, there is actually a triangle that relates these three. Okay, so you have your theory, you have your practice, and then you have your research. If you would look at that triangle, my dear students, there it always says that there is a two-way relationship between your theory, practice, and research. Now, what does this triangle tell us? No? What does this triangle tell us? So, plus this triangle tells us that your theory informs practice. Again, it tells us that your theory informs practice. In other words, we base our practice on theory. On the other hand, your practice also improves the theory. Your practice also develops the theory. Your practice also provides theory. In the same way, theory is connected to research. Research is also connected to practice. Now, can you name a certain theory that you have learned in your theoretical foundations of nursing? Can you tell me a particular theory that you have learned in your theoretical foundations of nursing? Drop it on the chat box. Sige nga. Name some theory. You have your healthcare. It's not healthcare deficit, but thank you for that. It's self-care deficit theory. Okay, but it's okay now. Very good capture. So you have your self-care deficit theory, which is by Dorothea Orem. Yes, ang walang kamatayang environmental theory, which is that of Florence Nightingale. Okay, what else? Uy, duha na lang ka-theory ang nabili. Okay, you're encouraged to turn on your cameras, ha? Okay, please do not turn off your cameras. Okay, now what else? What are the theory? Yes, theory of human caring, which is by John Watson. Okay, theory of human caring by John Watson. Now, if you would look at these theories actually, guys, you would know that these theories are the basis of why we practice. No? These are the theories that are the basis of our practice. So for example, when I talk about environmental theory, Florence Nightingale, the mother of modern nursing, reminds us that we need to clean the surroundings. We need to ensure that there is proper ventilation. We need to ensure that our patient would have adequate food. We need to ensure that our patient would have proper nutrition. Because according to Nightingale, these are the important things that our patient may have. Okay? So that's why we as nurses, we take care of those things for our patient. In the same way, my dear students, when we are talking about nursing informatics, there's also one theory, and that actually there are many theories, no? But allow me to introduce you first to a nursing theory, okay, that is related to nursing informatics. That nursing theory, guys, is what you refer to as your TCCN. Are you familiar with your TCCN? Have you heard of your TCCN? Okay, so class, what is TCCN? So your TCCN is actually technological competency as caring in nursing, which is by Dr. Locsin. Okay, Dr. Locsin class, Dr. Rosano Locsin is actually a Filipino. Okay, Dr. Locsin is a Filipino. As far as I'm concerned, he is currently based in Japan, and he is working with other experts there on the use of robots on the care of patients. Now, look at the theory, no? Look at the theory and try to read the title. It says technological competency as caring in nursing. Okay, this is the theory given to us by Dr. Lacson. Now, class, what is oftentimes, no? Let's go back muna to the modern world. What is oftentimes the concern when nurses handle technology? Sige nga, when nurses handle technology, ano ang oftentimes na concern na maririnig nyo from the patients? Anybody? Sige na, any rough idea? Diba, technology has been there, no? Technology is everywhere. You are using technology. Some of you may have been patients. Okay? How do you think technology influenced nursing practice? In a, let's say, negative way. Paano niya na-influence ang nursing practice? Sige nga, what are the common things that you can hear? Anybody? Okay, technology is complex. Yes, that's one thing. Technology is complex. What else? What's the common notion that we can hear? Yes, data privacy. Okay, data privacy is one of the concern. What else? High cost. Yes, that's correct. Mataas yung cost. Pero ano ang usual na subjective concern of the patients when nurses are using technology? Anong kadalasang sinasabi ng mga patients when nurses, for example, would enter the room and then they would touch the equipment, and then when you go to the nurses station, you would see nurses touching the computer. When you will go at the bedside, they are touching the electrical things there, okay, the technological advancements there. The usual concern class raised by our patient is that there's already a lack of personal touch, no? Ang kadalasang nire-raise ng patient natin is that there is already a lack of personal touch. Ano class ang kadalasang notion sa hospital? Patients would say na, uy, may time siya sa computer pero sa akin wala. May time siya sa machine pero sa akin wala. Okay? Okay, some of you are smiling, iba yung hugot niyo po. Huwag niyo pong damayin yung nursing informatics sa problema niyo sa love life. Okay? Ibang hugot po yan. Ha? Okay, pero parang ganun, so isipin niyo na lang na kayo yung patient, tapos siya yung nurse, no? Parang wala siyang time class because their time is already engrossed in the computers. Okay? That is one of the concern that we have, no? Especially at present, that these technology are being advanced, no? And this technology are being welcomed. Now, what does this theory tells us? No? It tells us that expertise or know-how, okay, your expertise or know-how in the use of technology is actually a manifestation of caring. Tingnan nyo lang yung sentence or tingnan nyo lang yung phrase. Technological competency is actually caring in nursing. Okay? So, it demotes the notion that, di ba, kadalasan pa nga, no, the usual argument perhaps that you might have heard is that there are people who would say, for example, or there are people who would say that nurses can be replaced by robots. Okay, I don't know if you've heard that notion, but we oftentimes discuss that in our conferences, that can nurses be really replaced by robots? Okay, that's the concern, no? But class, in the technological competency as caring, no? In the technological competency as caring in nursing, Dr. Rosano Locsin was very clear that nurses, okay, nurses class could not actually be replaced. Your nurses class could not actually be replaced by robots. Okay, that's one thing that we need to remember. No? So class, nurses could not actually be replaced by robots. And it is not the intention of technology to replace nurses. Okay, it is not the intention of technology to replace nurses. But we are reminded that we need to know technology because it is part of our caring for our patient. Okay, we need to know technology because it is part of caring for our patients. Now, let's say for example, we will be talking about, no, let's say for example that we will be talking about cardiac monitors. Okay? Allow me, are you familiar guys with cardiac monitors? Who among you have seen cardiac monitors on the field? Is there anybody who have seen cardiac monitors here, my dear students? Okay, in a while. Okay, there's my keyboard. So, no, cardiac tamponade is a disease process. Let's talk about cardiac monitors. Now, look at this cardiac monitor, guys. Sa mga hindi pa nakakita ng cardiac monitor kasi healthy kayo, tsaka hindi kayo nakakapunta ng hospital. Okay, so class, look at this. This is your cardiac monitor. If you would look at the cardiac monitor class, yes, it's a machine. Yes, it's an equipment. It's able to show class the heart rate of the patient. It's able class to show this is the heart rate of your patient here. This is class the oxygen saturation of your patient. This is class the blood pressure of your patient. And this one here is already the ECG of your patient. That is the ECG of your patient. Class, if I would say ECG, what part of the body is being looked into? Anong part ng katawan class ang tinitingnan natin in the ECG? Or what part of the body is being assessed in the ECG? Anybody? Sige na, that's part of your health assessment and fundamentals of nursing. When I talk about class your ECG, what part of the body is being assessed? Okay, very good, no? Very good. That will be your heart, no? That will be your heart because you should remember that your ECG stands for electrocardiogram. Electrocardiogram. That is your heart. Now, class, no? If we would think of the theory of Rossano-Loxin tells us that we should be able to use this type of equipment because if we are able to use this type of equipment, we are able to care for our patients. Picture if you are a nurse, tapos nandyan yung equipment na yan sa bedside, tapos titingnan mo, ha? Para sa ano yan? Okay? Para sa ano yung mga lines dyan? Okay? Plus, let's take for example the ECG. No? This is part of your MS, but it's wise also for you to recognize as early as now. Plus, this is the normal ECG tracing that you have. In anatomy, you are reminded that that is your P, that is your Q, that is your R, S, and that is your T wave. Okay? That's the normal ECG. Now, class, if you will see in the ECG that there is something like that, you don't think that, ay, okay, nag-change, unique siya. Unique siya kasi may changes sa ECG niya, no? Class, if you would look at this is actually already, no, I will label Q, R, S, this is your T. Class, that is actually already your ST segment elevation. Sir, bakit siya naging ST segment elevation? Okay? Mga future nurses, kung titingnan nyo, si ST po nandito po siya originally sa normal na sinasabi ko. In the abnormal that you're looking into, parang nag-raise up siya. Okay, so class, that is already your ST segment elevation. If you can recognize that, you already know that your patient is impending myocardial infarction. Your patient is actually already impending or actually having an active myocardial infarction. Plus yung tinatawag ba nating acute MI, okay? Or in simple terms, what we commonly refer to as your heart attack. Okay? Now, picture yourself, no? This is not yet the time for you to interpret ECG. You reserve that to your level 3. But picture yourself, class, if you are unable to recognize those lines, pagkatapos yung pasyente mo pending MI na, what would happen? Diba? Instead na yung patient mo sana naka-recover pa or naagapan pa na mag-cardiac arrest siya, your patient would be RIP. Rest in peace si pasyente kasi si nurse hindi alam paano gumamit ng technology. So Roxin reminds us that you as a nurse should be able to know how to use technology. Okay? Ano pa pong dapat nating malaman, ha? I would like to point this for the ECG. 1, class, you need to know how to turn on. Okay? Number 2, class, you need to know how to attach the leads. You need to know how to attach the leads. And number 3, class, you need to know how to assess further. And that would include class looking at the values there, okay, looking at the values and then comparing the values with normal. Okay, comparing the values class with normal. Okay? Those are the three basic things that you need to know. Sir, ano po yung leads, no? Hindi po yan lead, na tulad ng sinasabi ni chemistry. Leads po yung sinasabi ni sir. So, class, meron po tayong different leads ng ECG, no? Okay? Pardon the spelling, matalino naman si Google. So, class, ito po yung usual colors na ginagamit natin in the hospital setting for the 3-lead ECG. Okay? I don't know if you've undergone ECG, pero class, if you have undergone ECG, you are much aware that you are connected, no? You are connected on a certain tube. No? So, kinoconnect po tayo on a certain tube. Now, class, in your 3-lead ECG, ang ibig sabihin po dyan ng RA is right arm. LA po, class, is left arm. And then LL po, class, is left leg. Okay? Sir, hindi man na sa leg. Okay? Yes, class, hindi nga yan leg, pero it reminds you that you need to attach it near that area. You need to attach it near that area. Class, these are the usual colors that we use, the white, the black, and the red. No? Universal colors sana yan, but with the advent of technology, iba't ibang colors na po yung ginagamit when it comes to the ECG. So kung ikaw ang nurse, for example, nag-complain ng pasyente mo chest pain, okay? If you are a prudent nurse or if you are magaling na nurse, right away dapat i-connect mo yan. Sabi mo ito 3-lead ECG, place ka agad. Tapos refer kay doc, doc, may abnormalities tayo sa ECG. Nakikita ko may ST segment elevation. So right there and then, the doctor will be able to address the problem of your patient with medications, with further studies in such a way that maaagapan yung more severe problems on the end of the patient. Okay? So class, isa pa lang yan sa mga technology that are available in our hospitals, that are available even in the clinics, no? Later on if you're working in the advanced settings. So sir, will you be teaching us how to use this equipment? Plus, as much as I would want to, there are hundreds of equipment that are available. So ano pong tip ko sa inyo? When you will be in the hospital setting, when you will be, for example, in the skills laboratory, try to ask your instructor, try to ask your staff nurse as to how to deal with those equipment. Okay? Iba't ibang equipment po yan. Tapos, don't be shocked if the equipment in Hospital A is different from the equipment available in Hospital B, equipment available in Hospital C. Okay? Even just here in our locality. Now, if I would go back to the concept of TCCN, your TCCN actually illustrates the nursing grounded in the harmonious coexistence. Look at plus the words, no? The words are coexistence between technology and caring in nursing. So in other words, pag gusto po nating mag-care for our patients, again, we need to be knowledgeable about the technology. Okay, now look at this one. Technology is used to know the wholeness of a person's moment to moment. Now, the key word there that you might need to capture is the word wholeness. Okay, tinitingnan po natin yung wholeness of the patient. Okay, now, when you talk about plus the wholeness of the patient, when you talk about the wholeness of the patient, you look into that individual as a you look into that individual as a biopsychosocial being. Okay? You look into that individual as a biopsychosocial being. Now, class, what do we mean by that? No? Class, when we talk about taking care of our patients and then technology, one thing that I always emphasize is that we treat the patient, we manage the patient, and not the machine. We manage the patient and not the machine. Okay? But it is the technology that also help us to see the wholeness of that person. So when I say class wholeness, no, for example, if I will look at my patient, I will be able to see, no. For example, I would notice, ma'am, I have noticed that you seem to be sad. Okay? Notice nyo class ang term, we are not saying, ma'am, I notice you're depressed. Okay? Don't judge the patient right away. For example, I will tell you, Angel, you look depressed. So what would Angel feel, di ba? Sasabihin siguro ni Angel, ay kulang yung makeup ko siguro for today's video. Okay? Or the patient would say, hala, depressed na pala talaga ako. Ano? So class, notice the line that I said, ma'am, I noticed that you seem sad. Okay? You seem sad. And then class, that's the psychological aspect. Then class, for the biopsychosocial aspect, class, I will be able to see in the biopsychosocial aspect or the biological aspect of your patient that your patient's vital signs are present. Okay? Your patient's vital signs are present. Okay, your patient's vital signs are present. Then I will be able to see the health assessment. Okay, so you're able to see ano pa nga ba? 'Di ba in physical assessment, you would want to do the interview, you would also want to gather objective and subjective data from your patient. And then class social, gusto mong makita class kung yung patient mo nagko-connect nga ba sa ibang tao. Okay? So if you would notice, the help of the technology is more on the biological aspect. The help of the technology is more on the biological aspect. But mind you, developing technologies right now, class, no? For example, I just saw a study just today about schizophrenia, about detecting the feelings of a patient, okay? About detecting the feelings of a patient with schizophrenia. I don't know if you're familiar, no? I don't know if you are familiar with I don't know if you are familiar with schizophrenia. Have you heard of schizophrenia? Maybe in your
Yes,
health
sir.
assessment. Okay, yes. Okay, that's good, no? So plus, if you know patients with schizophrenia, you know that these patients actually have difficulty to project themselves. There may be abnormality in their affect. Sometimes they say that they will say ang lungkot ko pero they are laughing out loud. Okay? Or oftentimes, 'di ba, the bad local term for that is buang, 'di ba? We oftentimes refer to them as buang. But as nurses, please do not. Now, plus there is this research that I read this morning that they are trying to detect the feelings of patients with schizophrenia using a particular software. Okay? So, ano po yung message natin dyan? Plus, your technology is helping us actually understand the patient. It's helping us understand the patient. So, please do not think that, oh, since I'm holding into technology, I would not mind my patient. Since I'm getting hold of technology, wala na akong pakialam kay patient. Plus, no, the tendency kasi if you're working abroad, for example, you will be holding your phone. And then plus, while you're holding your phone, you're assessing your patient. You are being reminded that when you are doing that class, yes, you can do the click on your phone when you are assessing your patient. That's part of your work. No? However, class, don't forget to connect to your patient, converse to your patient, and please, no, always manage the patient. Maybe one of the common example that I've given in my previous lecture is the ECG flatline. Okay? The flatline plus in your ECG. So, di ba class sa movie, sa movie, yung mga common drama sa movies that, uy, nag-flatline. Tapos pag nag-flatline, CPR ka agad, Okay? Tapos class, di ba, electricity pa, shock. Now, as nurses, you should know, hindi po lahat ng cardiac arrest sinashock. Okay? Especially class, your flatline actually is not a candidate for shock. Okay? So class, pag flatline yan, hindi po yan pwedeng ini-electric shock. Pero now, let me go back to my point. Class, when I talk about the use of technology, for example, you had this patient with flatline. Class, you don't just do CPR right away without assessing your patient. Because your patient may be okay, your patient may be having some problems, pwedeng na-disconnect lang po, no? Isa pong common reason bakit nagpa-flatline po yan is na-disconnect po yung leads. No? Na-disconnect po yung leads. So don't right away jump into the conclusion, oy, patient needs electric shock. Hindi po ganon. Okay? Hindi po ganon. You always go back to the patient. Now, nurses class also value technological competency as expression of caring in nursing. Okay? Pero here in our setting, no, in the Philippine setting, we still find it a bit difficult. You know why? Technology kasi here is introduced in a slower pace. Pagkatapos plus, the tendency here is that technology, we find it difficult to use. No? For example, there are instances in the hospital, guys. No? Previously, I worked in the hospital. There are instances na kapag may kailangan kaming i-repair sa hospital, kailangan pa naming mag-wait ng 1 to 2 months just for the equipment, just for the parts of the equipment to arrive from abroad. Okay, so that's why minsan nagagalit si nurse. Pagkatapos, here in other settings, no, halimbawa mag-a-update si doc, mag-order si doc sa first floor ng hospital. Right away, class, the doctor will be able, or the nurses in the 5th floor, the nurses in the 8th floor, will be able to assess already that order. No? Nakikita na nila ang order right away. Pero class, here in our setting, ano po yung problema? Walang internet. Di ba? Or mabagal yung internet, slow internet connection. That's why sometimes we do not appreciate the value of technology. Now, look at the dimensions of technological value in the theory. So class, technology was found to be completing human beings. Okay? So what do we mean, class, by completing human beings? Now, let's look at this picture of prosthesis. May tinatawag po tayong prosthesis, di ba? For example, ortho, okay? Dahil sa sobrang pagmamahal, halimbawa, nabangga kayo ng isang sasakyan, tapos you lost your left arm, no? So you lost your right leg. Okay, let's say for example, right leg. Ano pong moral ng example? Huwag sobrahan ang pagmamahal. Okay, going on the point. So plus, you can see here that technology is actually used, to complete human beings. Okay, as you can see, your patient would feel okay. Your patient would feel able to function because there is actually already a prosthesis that substituted what was lost on his part. Okay, so class, technology could mean completing the human being. Now class, tulad ng sinabi ko, technology it's not always, class, because there are still patients who would feel incomplete. Okay? For example, ang patient mo may artificial leg na. Pagkatapos sinabi niya, nurse, I feel incomplete. Huwag niyo class sabihan yung pasyente niyo na, sir, may artificial leg ka na nga 100,000 pa yan. Pagkatapos you feel incomplete. Okay? Class, please understand that there are patients that would still experience like that. Then plus, your technology is also considered as machine technologies. So, as what we mentioned, you have your ECG earlier. Okay, so you have your ECG earlier. Plus, you also have your decision support systems. Okay, you also have class na, kita nyo class yung mga, maybe a simple example is, nakikita nyo sa grocery stores, wherein yung mga nag-i-endorse ng milk, class, tapos they are telling you that you are a candidate for osteoporosis, you are low risk for osteoporosis. Okay, that's also an example of a machine technology. Then the third point there, class, is technologies that mimic human beings and human activities. So example of those technologies, class, are your robotic nurses, no? So you have your robotic nurses as an example. So class, robo nurse, no? Actually, robo nurses, no, like this one, if I'm not mistaken, this is Pepper, whom we met in Japan. But anyway, there are many versions already of Pepper as of present. So class, technologies like this are being used in countries like Japan for the reason, guys, na their population is aging. Aging population kasi sila. And most of them were staying in nursing homes. So when I say nursing homes, it's like your home for the aged. So plus, ano po yung nangyayari dyan, ano? So these patients are being accommodated in the nursing homes, and that they would feel na parang wala silang kausap. So class, there are robots like this who would lead them in exercises. Okay, so nagsasalita yan, tapos nag-move as to how to do the exercises para lang may interaction. Okay, so that's what we meant by technology that mimic human beings and human activities. I don't know also if you've heard of Sophia. Okay, class, Sophia, as indicated here on this page, is a humanoid robot developed by a Hong Kong-based company way back in 2016. If I'm not mistaken, there's already a country that granted Sophia citizenship, no? So yeah, you have already technologies like that, and they are gaining popularity. Okay, they are gaining popularity already. So class, what does technological competency in as caring in nursing remind us? That there should be a harmonious coexistence between technologies and caring in nursing. Then class, look at this now. The technology should be able to bring the patient closer to the nurse. Yan sana ang goal. Hindi tulad ng sinasabi ko that the usual complaint is that sinasabi ng patient na yung nurse ko may time sa computer pero wala sa akin. Plus, supposedly, your work is reduced, your work is made to be efficient by that technology, and the purpose, class, of making that work efficient is that you will have more time with your patient. Okay? Ang goal sana, class, is that you will have more time with your patient. Pero anong nangyayari, sir, doon sila sa computer, doon sila sa cellphone. Ang cellphone, hindi naman para sa pasyente, para naman sa boyfriend at girlfriend. Okay? So please be mindful of that. And then class, when technology is used to know continuously in the moment, the process of the nursing process is actually lived. Okay? What do we mean by that? If we use the technology to understand our patient as they are in this moment, we are actually helping to become an effective nurse for our patients. Okay, are you getting the main point with that 2A? Sige. So 2A, do you have any questions in mind? Or do you have any points that you would want to raise? Sige. 2A, I will not be holding you for long. I hope that you have made already your requirement for the day.